Welcome to the Fitness Corner. I'm your host, Mark Bryant, and you're going to get a whole total body workout on my show, starting off with a warm-up, aerobics, strength training, cool down, and stretching every Friday from 11:30 to 12 right here on Rainier Avenue Radio.
This is the news on Rainier Avenue Radio. More deaths associated with Hurricane Laura were caused by the improper use of portable generators than the storm itself. And according to NPR, officials warn that the risk of carbon monoxide poisoning persists as thousands of households in Louisiana remain without power. 8 of the 15 hurricane-related deaths confirmed by the Louisiana Department of Health are attributed to carbon monoxide poisoning from portable generators, which can provide life-saving power in emergency situations, but also pose a deadly threat if used incorrectly. The unidentified victims of carbon monoxide poisoning range in age from 24 to 84 years old and outnumber the deaths caused by drowning, fallen trees, and storm cleanup. Most generator-related fatalities are caused by carbon monoxide, a colorless, odorless gas that can build up especially quickly in enclosed spaces. At certain levels, just 5 minutes of exposure is enough to be fatal. And that's your news on Rainier Avenue Radio.
You're listening to RainierAvenueRadio.world. Check us out on social media, Facebook and Instagram, RainierAvenueRadio.world, and on Twitter at RainierAvRadio.
Good afternoon. This is Juan Cotto, and I am here on your community radio station, RainierAvenueRadio.world. And today we have with us Callista Kennedy, and she is the project program manager for the King County Navigation Project. And so I wanted to welcome Callista onto the program today. And Callista, welcome to Rainier Avenue Radio.
Thank you. Thank you for having me today.
Appreciate you taking the time to chat with us. Callista, tell us, what is the King County Navigation Project?
It's actually, we're the lead organization for healthcare reform for King County for the health benefit exchange. So what our Navigator program is, it's a network of about 30 or so agencies, including community-based clinics and hospitals and service agencies that assist the public in accessing and applying for health insurance, be that Apple Health, be that qualified health plans through the exchange, the products that are offered through our Washington Health Plan Finder. So, and we currently have about 291 active navigators helping people across King County.
Let's ask this question, and obviously since COVID-19 has been such a huge issue in our community, what has been the impact of the coronavirus in Southeast and Central Seattle and in some of these lower income neighborhoods that you all tend to be working on?
We're seeing a lot of people that are losing insurance or some of the insurance that they're on is no longer really affordable because of the decreases in income, which of course leads to things like health disparities and higher instance rates of actually getting COVID and then the poor outcomes when it comes to the infection rate and actually treating it and the severity when they do get it. So yeah, we are seeing those impacts.
You were listening to Juan Cotto and the project program manager for the King County Navigation Project, Callista Kennedy, on your community radio station, RainierAvenueRadio.world, and we are talking about the impacts of the coronavirus. What types of resources are available for those experiencing challenges due to COVID-19?
So it really depends on what impact they're facing. There could be several avenues that we would refer them to. As I said, if we're talking about insurance, we're talking about linking people up with the Washington Apple Health Medicaid program if they're income eligible, or qualified health plans if they're maybe not income eligible or otherwise eligible, but able to purchase insurance through the exchange. We also, through what's called our Community Health Access Program line, that's an 800 number that our access and outreach team runs at King County. They can call that line, and we assist with other programs such as basic food, work to lift reduce transportation cards, breast and cervical health program, and then utility assistance, providing resources like if people need to know where to go for maybe the food distribution sites. We try to keep lists of things like that. We refer people to medical and dental health homes, and they call our 800 number, and we can help direct them to those type of resources. It's just going to depend on the need of the family, and what we can connect them to. So basically, they call our 800 number, which is 800 sorry, I'm drawing a blank on our 800 number. 1-800 55. Oh my goodness. So anyway, let me pull it up. I apologize for that. I normally don't forget that number. It's usually stuck in my head. It's 1-800-756-5437. Sorry about that.
1-800-756-5437. And that's important information, and even more important that is a toll-free line, so it gives people an opportunity to call from different places. Let me ask you this: walk me through the process. How would I know if I qualify for this program or
not? So basically, what we would do is when we start out talking about insurance, we use the Washington Health Plan Finder, and what that does is it allows us to add the person's personal information, such as their household members, their relationships, their income, citizenship and immigration status when needed. And then the system is going to determine from that information which route their insurance is going to go, whether it's going to go to our state Medicaid, Apple Health programs, or whether they're going to have to look at purchasing a plan. And if they qualify to enroll based on that information in a qualified health plan. So the system is really designed to guide us as to what they're going to be eligible for. The same thing, pretty much, if we're assisting someone with basic food application. And I know this afternoon we're going to talk a little bit about the PEBT program, which is the pandemic food assistance program for households with eligible children who are enrolled in free and reduced price lunch. So the good thing about applying in Washington is we do have technologically systems in place that help us enroll people in a really concise and time-sensitive manner so that we get them through efficiently and quickly so that they know pretty much by the end of their phone call whether or not they're going to, for most benefits, whether or not they're going to be eligible.
You are listening to Juan Cotto and Callista Kennedy. Callista is the project program manager for the King County Navigation Project, and she's taken some of her time to come out and chat with us today on your community radio station, our community radio station, RainierAvenueRadio.world. Ashley Steger will be interviewing John Galbraith, the executive director of Earshot Jazz, coming up following our program this afternoon, or following our section of the program, the impacts of the coronavirus that we do every Friday on RainierAvenueRadio.world. Callista, can you kind of dig in deeper into some of those programs in regards to food? I think a lot of people may think that this is just for healthcare and checking in to make sure that you're if you have the coronavirus or if you're not feeling well, you're able to get your health checked out. But this goes a little bit deeper, correct? You're talking about food and other services being provided as well.
Yes, that's correct. One of the things that we're seeing is with a lot of people becoming eligible for or being unemployed and being on unemployment is that more households qualify for and should be applying for EBT, otherwise known as food stamps. And so that program in Washington State serves households up to 200% of the poverty level. And so that gives households the ability to have some assistance in purchasing their food. And so what we're seeing is that people who were not previously eligible for that type of assistance are now becoming eligible. The state has also worked to get more assistance in folks' hands when it comes to applying for those benefits, because the amounts can vary. So they've done some work in the last few months where people have gotten more of an allotment than they may have gotten previously. So those programs are out there to help. And then what has been rolled out over the last, since the end of June, is the PEBT, or pandemic EBT benefits. And how those benefits work is if you have a child that was enrolled in the school year 2019 to 2020, before we closed down the schools due to the pandemic in March, if they were enrolled onto free or reduced price lunch by the school at that time, they would receive up to $399 per child on a state EBT card that they could use to help them purchase food. That program is still allowing us to enter students who have not received that benefit. We can continue to help them through 5 p.m. this evening to access that program. And then if they had enrolled in early July, they would have gotten the full $399. It is prorated out based on the month that they apply. So they may not get a full $399 at this point, but they would get that PEBT supplement. If they already have an existing food stamp benefit, they should have gotten that already. If they haven't gotten that or they weren't enrolled in basic food, we're still encouraging people to call us. We can help you apply, again, through our chat line, 1-800-756-5437. Or if they want to access the state site directly, it's WashingtonConnection, all one word, .org. And it's a simplified application. It's just the household members' information, address, the children's names, dates of birth, and what school they go to and what district. So it's a pretty simplified application, but we're here to help people go through that so that they can access those benefits. The other thing is this does not affect your ability to still go to the school sites that are doing daily food distribution. You can still go to your school where they're handing out the lunches for families. So you can do both with this program. So we're still encouraging people to do that. Sorry.
You are listening to Callista Kennedy, who is the project program manager for the King County Navigation Project. And I think many of you may know me. I'm Juan Cotto, South End community guy, and you usually hear me during the high school football season. And obviously that's been postponed till spring. And Callista, we at Rainier Avenue Radio.world, we tell the stories of people in our community, and hearing sports and kids out playing and sharing those stories with our community is so important. And one of the things that COVID has taken away from us, unfortunately, is opportunities to play sports. So we're looking forward to getting back to those on Rainier Avenue Radio.world when the time comes. I want to ask you, there's two vulnerable populations. Obviously, you touched on it with children. Seniors also are a vulnerable population. And I was wondering if there are any programs that are directed towards the senior age group.
So we do still have some of the senior farmers market vouchers that they can apply for. That program normally is they have to apply for it early in the farmers market season, but due to the delays in the farmers market getting open, they are, I believe, through the end of this month, still able to apply for those additional farmers market checks. And they still, I think I'm getting disruption. Sorry. So the senior farmers market checks, I believe, are still available. And then there's not any special rollouts that they've done. But like I said, one of the things that DSHS has been doing over the last few months, when folks are qualified for EBT, normally prorate the allotment that folks get based upon the amount of income, and then they do a reduction based on, you know, what their shelter cost is, what their rent and utilities are. What they've done is over the past several months, those clients who are on EBT have been able to get the full allotment for their household. So for example, a lot of people that are on Social Security benefits get a $16 allotment of basic food. And so instead of getting that $16 allotment, if they're a single adult, they would be getting the full $194. So that's some of the things that they've done that's one of the things that they've done to kind of dispel the impact a little bit for populations such as seniors.
And I just wanted to emphasize again, and you said it earlier, but there is a deadline today, correct?
Yes.
And that's for the purpose. So let's go ahead and just kind of go over that deadline one more time. And maybe there's some people who are listening who have some families that may be interested. And where do they need to get to again? Is that to the 1-800 number?
Yes. So the PEBT benefits for the school-age children, the application deadline is today, September 11th at 5 p.m. They can call us through our CHAP line at 1-800-756-5437. They can also go to the DSHS Direct website. It's WashingtonConnection.org, and that's all one word, no spaces, no dots, no anything, WashingtonConnection.org. And also, I believe Parent Help 123, done by Within Reach, is also assists clients in applying for that program as well. So they can access through any of those avenues. We encourage folks to, if they're getting, you know, if they're not sure that they got it, or they're pretty sure they didn't get it, to go ahead and, you know, make sure they put in the application. You know, a denial never hurts anyone. It's just a piece of paper saying, hey, you already got this, or hey, you're not eligible for it. So we always encourage people to go ahead and do that. The other thing is with the upcoming school year, we encourage folks to still go ahead and get their students registered for free and reduced price lunch, even though they're not in school right now, or they may, you know, because we're doing online. We always encourage people to go ahead and do that, get them enrolled in that, because if this program does get extended into the school year, having them already on the rolls makes this process a lot easier for folks to access. So we encourage them to go ahead and go to the school and make sure that they're enrolled. That way, if we, you know, could say, hey, we're going to do this again, they're already in the system.
You are listening to Juan Cotto of RainierAvenueRadio.world and Callista Kennedy. Callista is the project program manager for the King County Navigation Project, and they are providing services, and we are going over some of those services that her group provides to folks here in the communities. And we're talking about a little bit of a deadline that is coming up, but this is your community radio station, our community radio station, RainierAvenueRadio.world, on our Fridays, talking about the impacts of the coronavirus. And for the participants in the program, Callista, what has been the impact? How many folks have you served so far?
Oh, wow. I don't have hard numbers on the PEBT program. It's been quite a few. I think for July and August, for EBT benefits, our group in and of itself were somewhere around 1,500 or something, just for our group of 26 staff. We were at that many. So it's definitely a jump. I mean, prior to this, we would maybe do, when we're talking about EBT, we would comparatively maybe do 60 to 70. And wow. So yeah, when we're talking about per month. So it's been quite an increase in folks. So
how big a staff do you have, and are you working with them?
Our team, we have 26. We have 26 staff. We have our outreach staff, where, you know, non-pandemic, normal business, we would be out in the community. We go to health fairs. We go to ongoing locations like community colleges, libraries, and things like that, where people can come and access our services. We have 2 storefront locations, one at King Street and one in Federal Way, where people can come and get on-site help for services. Our outreach staff, they work those, and then we have on-site clinic staff that work in the 9 public health centers to do the work for the folks that are coming into our clinics. And so, yeah, we're normally out and about and around. We are still having staff that are actually going to some of our ongoing COVID-19 testing sites, like the one at the Showware Center in Kent. So when folks go there, if they need help with insurance or enrollment in our OrgaLift program, we have staff on site to do that. So yeah, we're good solid staff. We have people that speak 5 different languages: Spanish, Vietnamese, Amharic, Korean, Somali. So yeah, we have staff that speak the languages of some of the communities that we serve as well.
And how are you received? I think in times like this, some families may, tend to withdraw. They may feel like, geez, do I really need this type of help, or do I want it? Do I qualify for it? How do you build those relationships to make sure that people, this isn't something to be looked down upon? I mean, if you're needing access to food and certain types of supplies, this is a service that's there for you.
Yeah, absolutely. Our relationships to the public that we serve are actually pretty tight. It does help us quite a bit that we have staff that look like the communities and are part of the communities that we serve. Like I said, our Spanish and our Vietnamese speaking staff, our Amharic staff, having people on our team that are part of the communities that we serve. We're out there and we're in places where they normally go. So it's not like we're pulling them out of their community either to go seek out services. So, if we go into their church, that's where we go into, so we do a lot of trying to really do true outreach, which is going out to them and then offering as much one-stop shop. One of the things that we employ that seems to work really, really well is when we approach someone, we let them tell us what they need.
Yes.
And then once the need that they brought forth is met, if we have something else that's related to it, then we can add it in. So if someone comes to us and say, hey, I need an OrgaLift card. Okay, let's get you this OrgaLift card. But in doing the OrgaLift card, we discover, I just changed my job and I don't have that insurance anymore. Well, let's see if we can offer you the insurance. So we do that one-stop shop method, and it tends to really make us engaged with the person and then with their communities. So I think we're lucky to have the people that we have on our staff.
That is so awesome. This is Juan Cotto of RainierAvenueRadio.world. And Callista Kennedy, the project program manager for the King County Navigation Project, giving us information on where people can go. And let's just kind of go over this. Let's recap our conversation, Callista, and our RainierAvenueRadio.world impacts of the coronavirus. Let's give people just one more. Let's give the phone number again, and let's give them an update on the type of programs they would like that they could potentially receive themselves. Or if there are families that they know that are in need, they could get this information out to them right now today, because the deadline is at 5:00 today. So if you could just kind of recap some of the programs that are available and tell them how to access those programs.
Okay. Yes. So the program that is ending at 5 p.m. today is the PEBT program, or Pandemic EBT, and it's for school-age children that are enrolled in free and reduced price lunch. And it gives people up to $399 on the EBT basic food card through the state of Washington. Our access and outreach team, through our CHAP line, Community Health Access Program line, helps people enroll in PEBT as well as regular EBT food stamp benefits. We do health insurance, both Washington Apple Health and qualified health plans through the Health Benefit Exchange. We help with energy assistance programs, also Washington Breast and Cervical Health programs. We help with connecting with medical and dental health homes and other resources that the public may need. And you can reach us at that line at 800-756-5437. and we're there Monday through Friday. Line opens at 8 and ends at 5. We don't take a break during the day, so there's no lunch closure or anything. You can call us anytime during that time, and there will be navigators and staff on the line. We have multiple languages available for people who need assistance in languages such as Spanish, Somali, Amharic, Vietnamese, Korean. So we have those all available for the public who need help with things. So
we appreciate so much the work that you do in the community. And what does the next few months look like for COVID-19 and people looking to access programs? How are you guys bracing? It doesn't seem like this is going to end anytime soon in regards to the pandemic. What can people start to expect as we move forward into the school year and into 2021?
I wish we had steadfast and clear answers to that. The truth is with a lot of it, it's just us preparing for. It's almost preparing for the worst of it. If we go back, to where we're not open anymore, we hope we don't have to slide back that far. But it's just continuing to provide access for people to continue to get the service they need. We're gearing up for the open enrollment. We will have new health plans coming up in January and new programs through our Cascade Care. So we're gearing up for open enrollment. So a lot more to come.
Callista, I would just want to say on behalf of RainierAvenueRadio.world, thank you so much for taking time to spend with us today and to tell us more about these programs. And I am hoping that this will get out to everyone and who can get this information to people that in the community that will be helpful. So thank you so much for your time today.
Oh, you're welcome. Thank you for having me.
This has been Juan Cotto with Callista Kennedy. She is the project program manager for the King County Navigation Project. And we will go on now to Ashley Steiger, who's going to be interviewing John Gilbreth, the executive director of the Earshot Jazz Festival. So signing off on your community radio station, our community radio station, RainierAvenueRadio.world.
Would you like to see when your favorite Rainier Avenue Radio show comes on? Check out our show schedule, updated weekly at RainierAvenueRadio.world.
Sunday nights from 9 p.m. to 11 p.m. Pacific Standard Time. It's K-Fox Night Beat with DJ Nastiness.
Bringing back the memories.
Bringing back the memories.
Bringing Seattle's hottest music.
Bringing Seattle's hottest music. RainierAvenueRadio.world.